Good morning, Kaitlin.
Good morning.
Hi, Kaitlin.
Hi. Thank you so much for talking with me.
Oh, it's our pleasure.
So I just had a few questions. What did the survey find about the stigma attached to bariatric surgery?
Well, unfortunately, not surprising is what is shown. Despite the epidemic of obesity in this country, very few individuals are communicating with their primary care doctor about treatment options. So it is thought that the doctor doesn't want the patient to bring it up, which is in fact false. But also the physician doesn't feel like they have the good treatment options or to recommend bariatric surgery specifically. So it's really conundrum, if you will, because we have this epidemic, but there's really not the dialogue to get the word out about the successful treatments of bariatric surgery.
So when that's the case, how can patients and doctors have frank and productive conversations about weight loss surgery?
I think they have to go both ways. I think that we have to educate the primary care doctors about not only the weight loss surgery, but the profound medical benefits that bariatric surgery has. I mean, I think that's key because once you get them comfortable referring and they find out that it's safe and effective, then they continue the referral pattern. Same thing with patients. They need to be open with their doctor and say, look, is there anything else I can do for my weight? I've been struggling for my weight for years. You know, with medical management, we lose 5 to 10% of our weight, but 98% of the time we regain it back. So I think there has to be that open dialogue between the patient and the surgeon. Isn't that what happened with you?
Yeah, with me, I would come to the doctor and there'd be, one thing wrong, your cholesterol was high. Well, the next time my blood pressure was high. Then I became diabetic, and it was the same answer from my physician, diet and exercise, diet and exercise. And finally, I did do the research on my own. I brought it to my doctor. I explained my reasons why, and we kind of went through it together to make an educated decision on both of our parts. And since then, he's been, really open and supportive. And I just wish I would have been brave enough to have that conversation sooner.
Which is very similar to my story, too. So that's what my next question was. For patients who have already had weight loss surgery, how can we help to ease the stigma surrounding bariatric surgery? How can we help to educate physicians?
Well, I'm hoping with my blog and what I'm doing that there'll be that one person that watches it that says, oh, well, let me explore my options, and then they present it to their doctor. I think the results speak for themselves. It's amazing how far I've come in the past 3 months. I'm no longer on any medications, and I've lost 55 pounds as a bonus. But the great thing for me was getting rid of all the medicines that I used to take. So I'm just hoping that someone will see this and someone will say, well, hey, she did it. I'm just a normal mom. You can do it too, but it's that awkward situation, just stepping in that awkward place and saying, hey, I need to do a little more. And your doctor, I'm sure, will support your decision or help you come to a good decision.
Yeah, I think blogging is a huge step in the right direction to educating patients, because patients then will in turn go to their primary care doctor. Then we need to, on our end, continue to educate primary care doctors on the profound medical benefit. And hopefully over time, there'll be an open communication. I mean, just think, this is an epidemic in this country, and we don't talk about it during a medical appointment due to a variety of reasons. So I think we have a long way to go, but we've made some great strides in the last 5 years. And I think your blogging and these different Facebook, social media, if you will, is really helping the cause.
And Tracy, what is the URL? Can you give that out real fast?
Yeah, it's heartonmysleeveblog.com.
Thank you. So in my case, I was the one to raise the possibility of bariatric surgery to my physician, and it seems like that's often the case from the survey results. What can be done to help primary care physicians consider weight loss surgery independently and offer it as an option to patients?
I think just trying to get the word out about the profound medical benefits and take it off the stigma of just weight loss. You know, and because that's a very powerful message to primary care doctors, that not only are you going to lose weight, but you're going to get off your medications for diabetes, sleep apnea, cholesterol, blood pressure. That is what we do on a daily basis. And so being able to have one surgery that is safe and effective and long-term outcomes, I think we just need to continue to beat the drum and educate the primary care docs.
Excellent. Well, thank you both so much. I really appreciate talking to you both.
Oh, thank you.
Thank you.